Hi, I'm Dr. Charles Eaton with the Dupuytren Foundation. I recently went to the annual meeting of the American Society for Surgery of the Hand to interview hand surgeons about Dupuytren disease. I asked each of the surgeons a similar set of questions. Here are the answers to the following question. What is the one thing that you think Dupuytren patients want the most?
I don't think there is one thing that they desire, because this is such a strange condition. I have women who come because of the cosmetic problem with the palm of their hand,
right,
or the problems with wearing a favorite ring that suddenly doesn't fit. And then I have 80-year-old retired golfers who come because they can no longer hold their golf club. So I don't think there is a single thing. I think they want it putting back, their hand putting back to where it was good.
Right.
They all have different issues and different demands. So you can see a patient who comes in and all they have is a nodule, and what they really want is information.
Right.
And they want an understanding of what's going to happen to them. And perhaps that is the most common, but there's also the other spectrum of the patient who comes in and they've got 4 fingers like this, and you wonder how they've functioned.
Right.
And they're maybe 65, 70 years old, and all they want is a little bit more extension,
Right.
just so they can get their hand a little more open.
Right.
So it's very interesting how different people manage their problems differently.
I think it's just a reflection. Single most thing that they want is to be able to get their hand flat so they can put it on a table or in their pocket.
Right.
They want a cure.
Right.
They want a simple
Right.
cure. They want it to be easy. They want it to be relatively pain-free, and they want it to be cheap.
Right. Well,
And they want it to be permanent.
is that so much to ask?
It is of Dupuytren.
It is. For now.
I think the number one thing patients want is information. What's happening to me? And is it going to get worse?
Well, basically, they want to be able to use their hand. As the contracture gets worse and worse, they can't get their hand in the pocket. And in Cleveland, we have harsh winters, and they can't get gloves on.
Right.
And it's very uncomfortable. They can't shake hands. They feel embarrassed. Some patients can't do the job that they're assigned to.
Half the patients are just concerned about what they have and what it means to them going forward.
Right.
And so they would love simply, a lot of them would love a way to kind of halt that process or be able to reverse it.
Right.
Well, they clearly want to understand what they have, because they come into my office many times knowing just about as much about Dupuytren's disease as I do. So I think they want information. That's very important. And they also are trying to understand how to deal with their disease without surgery as long as they can.
Right.
They want their fingers straighter, and often they don't understand when they first come to see me that sometimes trying to make a finger that goes all the way straight leads to a finger that doesn't bend all the way, and that's not usually a very good trade-off.
True.
I think they want mostly a reliable treatment that will work for a long period of time, or maybe even cure them of this problem, and that's just very hard to do reliably with surgical treatments.
Right.
They just want to get their hand back. They want to be able to open and close their hand without pain and do all the things that they normally do. That's what they want.
Just want to turn the clock.
My patients are coming saying that they can't wash their face in the morning, so
Yes.
that's the first complaint they've got, and normally also they can't put the hand in the pocket, so
Right.
that's another one, so, but otherwise when you do the dash, so you've got perfectly normal hand
Right.
in most
Right.
of
That's
cases,
really
so
the big problem. Is
it's
that
useless, so
and
for us.
some people have a small contracture, and they're very bothered by it.
Yeah.
And some people have a terrible contracture, and they're good. Treatment.
Well, I think the first one is they're worried they have a lump in their palm and their sister had cancer, so they come in because, I'm scared about this lump. And once it's clear that it's not that and it's not a functional problem, they're gone. The functional people come in because, particularly of the PIP contracture, more so than the MP contracture, you can tolerate more MP contracture than we would like as Dupuytren's treaters, but they come in really with a PIP where they hook it on their pocket, they hook it when they're shaking hands. They just have trouble clearing things, or they have trouble gripping clubs, for example, the golfer being the classic example where he has trouble getting his golf glove on.
The glove, not the club.
Yeah, the glove, not the club.
That they desire.
They want to be able to straighten their hand again. They want to be able to get away from expecting people to give them a blessing every time they pick up their hand. They want to be able to do various activities. Most of the older fellas who come in can play golf because they can grip.
Right.
But they want to be able to open their hand, get their hands in their pockets, be able to wash their face, or women putting on makeup, or men putting on makeup for that matter. Yeah.
Washing.
I mean, they just want a hand that's more functional. They want a hand that they can use to hold things, be able to put in their pocket, be able to clap with. I mean, they really are never looking for perfection. I mean, they just want a hand that works better and that doesn't get in the way like a contracted hand would.
Yep.
They want a cure.
Yep, I agree with that. People come in, they don't think that it's any big deal. They figure they will just have some quick procedure and they can put it behind them, and they're generally surprised and not happy that they have a lifetime to look at it.
Right.
That's something that would be great to change.
The most bothersome thing, they want straighter fingers. As we know, Dupuytren's tends not to be in and of itself painful. So another part of the misconception sometimes is really kind of defining, is there something else going on? It's usually, it can be base of thumb arthritis, some arthritis in the fingers, and so you really have to have a good understanding with your patient about what you're actually treating. And so I think my job as a physician is to educate them, tell them that we can get them straighter fingers, but we may have to address some of those other issues separately.
Right. I think they actually come into my office with a couple of questions. One is, what is this? So they want an answer as to what the disease is. And second, can you stop it? And can you reverse it?
Right.
Well, at some point they may experience some disability because they can't put their hands in the pockets and they can't wash their faces anymore and things like that. And what they want is to be able to do the normal things again.
Right, right. That's not too much to ask, really.
No,
so
sometimes difficult to deliver.
It's you to get right.
My patients want to be able to use their hand better.
Okay, that's a lot of territory there, but
but when they say they're having trouble playing golf or getting their hand out of their pocket or putting on a pair of gloves, and I do live in a wintertime state, so
right.
In fact, it's winter.
Well, it depends. Oftentimes it's, I can't play golf, and I live for golf. They can't hold the club anymore. Or how long will I be off playing golf? Or obviously the inability to function given the contracture and deformities.
Well, I hope you like that. Don't forget to subscribe to the Dupuytren Foundation YouTube channel. Check out our website at dupuytrens.org and sign up for our newsletter to follow progress toward finding a cure for Dupuytren disease. Thanks.